Let's talk about Lisa. What's been your involvement with Lisa's journey?
Well, it actually started a number of years ago. I'm not too sure when. That was the time when Rochelle was still quite young. I was actually the doctor of Rochelle, and in the process of looking after Rochelle, then she mentioned Justin. At that time, he was actually under the care of a pediatrician and who was struggling a bit with the medication. So this is where I came in. I kind of like communicated with the pediatrician and offered some help and second opinion. So this is when he was, before he was 18. So in that way, I kind of like at the background providing some help in the area of the use of medication, especially pertaining to what we call psychotropic medications, which is a class of medications used for psychological disorders. So when he turned 18, then the pediatrician said, "Hey, Kam, why don't you take over his care?" And the rest is history, I guess. Yes.
What do you see as some of the challenges that Lisa has faced in caring for Justin?
I think there are a number of challenges. It is always very difficult to look after a child with autism spectrum disorder. And unfortunately, autism spectrum disorder doesn't come on its own. Usually comes with attention deficit hyperactivity disorder, learning difficulties, anxiety is one of them. I have to say that in my life as a child psychiatrist, I have not actually come across a person with ASD, let's use the short-term ASD rather than autism spectrum disorder, without anxiety. So some form of anxiety disorders and obsessive compulsive disorders always comes with it. And definitely with an ASD person, they have what we call frustration management problem. They just don't know how to deal with the day-to-day frustration of life. And very often it comes out in a way of aggressions and anger. So I can understand her problems. But the other issue too is that a lot of people forget that when you have a child with ASD, it actually has a great impact, not only on the other siblings, but also on the rest of the family. So ASD has a real kind of a negative impact on the family. And I think that is a struggle that Lisa has, and especially when she's a working mom as well, trying to juggle catering for the family, looking after the family, trying to juggle looking after Justine, and also to look after Rochelle, who was very, very much affected by Justine at that time.
So how can, you mentioned Rochelle.
Yes.
How can the siblings of children with autism be affected? What are some of the implications of that in terms of the relationships and the parent-child relationships and sibling-sibling relationships?
Well, I think the first thing is that an ASD person takes a lot of the parents' time. Literally, I think it's kind of a daily process. One of the difficulties of an ASD person is to really process the day-to-day living experiences, because they just experience the world quite differently. So parents have to spend a lot of time, let's say, debriefing the ASD child that is in the absence of other issues. Then the parents also have to deal with the behavioral issues and the emotional issues. So sometimes whatever time that the parents have for the entire family can just be taken up by the child. So you can imagine that even the best of parents sometimes may not give enough time to the other kids who don't have ASD. So that is the first problem. Getting the child to understand that, look, your brother has special need, therefore I have to spend 4 hours with him, I can only spend 30 minutes with you, is a great ask for a lot of kids. That is the first problem. So the quality time of a non-ASD child with the parents a lot of times get dissipated. The other one is because a lot of the ASD they have to manage in terms of behavior therapy by the parents, and because the behavior issues can be quite severe, so it's almost like for the non-ASD child is, well, look, you know, he always gets away with things. He yells at you, you don't send him to the room. You know, I raise my voice, and then you say I get grounded for the rest of the week. So there is the perception of unfair treatment as well, that you just, you know, you're just not fair to me. So you can imagine that coupled with the lack of time, then it's very easy for the non-ASD child to be quite resentful, that you don't love me, you don't have time for me, you give all the time to my brother. And so that is the second issues. And of course, then, you know, with that, it produces a lot of what we call sibling rivalry. And sometimes unconsciously, the non-ASD offspring would produce some behavior problems as well. It's like, if I'm a good child, if I don't get your attention, if I'm a bad child, if I start to yell at you, if I become difficult, maybe I would get your attention. Now, I have to say that all this is unconscious. Okay, we in psychiatry, we call it unconscious. So it's not like the child dreams about it, that this is the best way to get mom's attention. So that is the second issue. And of course, the other one, which is very, very common, is the ASD child would a lot of times put the frustration onto the other sibling. So it is not uncommon that in a family with many children, a ASD child would target one who is more malleable, who is more easy, and puts all the frustration, the anger onto that nice and soft sibling. So the ASD child a lot of times go to school without any problems, and then take home all the frustration. And as soon as he gets home, then things just explode, and he just puts on all the frustration onto the other siblings. So these are some of the issues. Not to mention the fact that sometimes the parents' marriage can be affected too. This is where parents get drawn in. Sometimes when the non-ASD child perceives that mom or dad is partial towards her own brother who has ASD, then the other parent may overcompensate. So you have one parent who is perceived as harsh, and the other person who is perceived as lenient, and eventually there is a lot of argument about child management. So it is a very, very difficult task. Yeah.
So we've talked about a lot of the challenges. What about, are there any joys? Are there any highlights? Are there any moments where on a parent's journey with a child with ASD can breathe a sigh of relief or have a smile on their face?
Well, I think there is. I think in this case, the parents really have to redefine their own expectations. I think a lot of times as parents, we have expectations that, look, you know, I have a 3-year-old, and the 3-year-old is supposed to do this, and we get very happy, you know, and then the child goes to school, comes home with a list of spelling bee that is 10 out of 10, then we get very happy, and participating in a T-ball and that sort of thing, and we go to witness and the child playing, and we get so happy when the child does the home run. But I think the sort of joy and the sort of milestones that ASD children achieve, the parents actually have to change that. So the little joys are things like, oh, today little Johnny go to school and he didn't chuck a tantrum, or we arrive at the school gate and he didn't scream and yell and he just walked into the school. Or today, you know, when he leaves school and his friends say hi to him and he waved to them, and rather than being shy and not responding. Or look, you know, last weekend we decided to go to a Japanese restaurant, and finally he comes with us. And although, you know, we have to leave half an hour later, we get to eat our meal, and that is a little achievement. So those are the little things that parents have to celebrate. I always ask them and say, you have to celebrate that. So things that we take for granted, that the normal, if I can use that word, the normal child would do, things that are quite, let's say, ordinary, those are the things that parents have the joy and the celebration. Because one of the things that we don't understand, and it actually took me some time even to understand, the life of an ASD person is very different from us. And I come to realize that the life of an ASD person at the best of time is very angsty, if I can use that word. They usually wake up with a sense of unease about life, and life has to be perfectly routine. We call that pattern, we call that stereotype. So life has to be perfect routine. The time that I eat my breakfast, the time that I put on my uniform, and the taxi that is going to come to take me to school, and I know who the taxi driver is. So everything is all pattern. Anything that is out of the ordinary is a big deal. It's a big stress. And we tend to underestimate that. When I say anything that is out of the ordinary, it could be mom deciding that, oh, look, on the way home, I just have to drop by Woolworths to get a bottle of milk. Now, that is a big deal because usually mom takes me home. And then when I arrive home, I spend half an hour on the Nintendo or the PlayStation. So being interrupted and because mom has to pick up a bottle of milk at Woolworth, it's a big deal. And the person just doesn't put it in perspective that, well, look, if I don't pick up the milk, we're not going to have milk the next day for your breakfast. But for the ASD child, is a great trauma. So to celebrate with the child that today life is great. Today, you don't have a lot of angst. Today, you deal with the little challenges in life. Those are the moments that ASD parents with ASD child have to celebrate. And I think they have to keep that in perspective.
Yeah. You've talked about the family. What about outside the family? Community groups, sporting groups, school, church? How can these organizations be helpful for families with an ASD child?
Well, I think first of all, we have to learn what ASD is, and I think a lot of people don't. Because the word autism actually is quite scary for most people. I think most people, when they hear the word autism, they think about what we call the classical autistic disorder, or these days using the DSM-5 classification is the level 3. So straight away we think about that. Straight away we think about this child chucking tantrum and have a lot of difficulties and being aggressive. So I think the first thing that we have to do is to change our understanding of autism, that this child is not dangerous. But the other thing which is very, very important for people to realize, and I always tell the parents that we have to realize that even though child psychiatrists and adolescent psychiatrists, we look after ASD people, technically ASD is not a psychiatric disorder. Okay, when I talk about psychiatric disorder, I talk about things like schizophrenia and bipolar disorder. Technically, it's what we call neurodevelopmental disorder. It's got to do with the way that the brain of an ASD person is wired. So if you want to look at it that way, you can kind of shorten it and say, wow, it's more like a neurological disorder. So once we think about it as a neurodevelopmental disorder, then straight away the stigma and the fear disappear. So that is one understanding. And the other one is that is to understand that the neurodevelopmental disorder gives rise to a different interpretation and a different appreciation of the daily life experiences. So once we understand that, then we have a lot more, I suppose, sympathy or empathy for the person. They just experience life differently, right? The classical one is ASD people have a noise sensitivity, for example. They don't like loud noises, thunder, and a vacuum cleaner sets them off. And that is the reason why they don't like to go to restaurant, because it's just so noisy. So, so many people speaking at the same time. So once we understand that, hey, it's a neurodevelopmental disorder, the way they experience life is different. The way that they experience what we call our sensory experiences is different. Things that we experience as a touch, for them, it could be something that is a lot of pressure, and they experience temperature differently as well. And obviously, they interpret social communication differently. So once we understand that, then we cater for that. So for example, ASD people they're no good at jokes, okay? Because they take things literally. They take things literally. And sometimes even I catch myself by surprise, because in my profession, I like to be lighthearted with my patients. And sometimes I crack jokes, and the person actually takes it very literally. And so I remember there was one session that I have a patient, and he likes Thunderbird beer, okay? But Bundaberg beer, not Thunderbird. And he came in and he has Bundaberg beer in his hand. I say, oh, look, where's mine? And an ordinary non-ASD adolescent would know that I joke, okay? And he was profusely apologetic and say, oh, look, my mom only bought me one, and the next time I make sure that she's going to buy another one for you. And there was another occasions where I saw this adolescent. He has ASD, and it was before Christmas. I think I made an appointment when I saw him, it was October. I made another appointment nearer, so it was sometime in early December. Then I say, oh, look, it's near Christmas, and you make sure that you bring me a present. And he got really serious, and he turned to his dad and said, oh yeah, we have to make sure that we get Dr. Wong a present. You have to take me to shop. So they take things very literally. So we have to understand that. I think once we can do that, then we can relate. We'll be more patient. We wait for the person to process his experience. The other thing that we have to realize about ASD, especially when we are in the caring community like a church and a youth group and teachers, is ASD, they don't generalize things well. Human being, we learn things by generalizing. What do I mean by that? So for example, our parents teach us that, look, you don't hit somebody, okay? Because that is no good, and hitting another person is no good. So once we learn that, we know that hitting also means throwing stones, throwing rocks, and so we generalize it. From hitting, we understand that it means hurting another one. So we would not physically hurt another person. Now for ASD, it's like, yes, you teach me not to hurt him, but it's okay for me to throw stone at him because I'm not hitting him. So to the ASD person, it's very black and white. And that's the reason why life experiences for them is very difficult. So once we understand that they don't generalize, they take time to process information, they process the world very differently, they have problem dealing with frustration, and then we can actually come around the ASD person. I think the main thing really is patience and understanding, and constantly ask ourselves, what does this mean to him? Rather than, oh, I've experienced like this before, this means this for him. It's more like, what does this mean for that person? And I think that is very important. I feel that the church actually has a lot to contribute, really. I say that not because I'm speaking to you, a Christian. I say that because I feel that the church is the community that is going to support all these people. As always, I always tell the parents that, look, you are the most important person. I tell the parents, I'm not, okay? I'm the expert. I've got the knowledge, but I don't live with your child. So I can teach you how to do it, right? But I only teach you, but I don't live with him. So you have to do it with him so that he can practice living the non-ASD way. And you are the coach. and I'm helping you with it. So parents are very important. So which means the community to which the family belongs is very important. The youth group and uh, the church and scout, if the child join any scout movement, extended family is important as well. I can't underestimate the role of the grandparents. So, and obviously uncles and aunties, sometimes they can provide respite for the young ASD person, so that mom and dad can get a bit of help. So it is very much a community effort. Well, the thing that I want to add is to encourage the church to come alongside in a real practical way. I'm actually very excited about the program that Justin is going through. I think it's the first time that I'm actually doing this. I've been in practice for 20 over years. And one of the difficulties of bringing up ASD young person is that by the time they leave school, it's pretty much a dead end. I have to say that it's a dead end. To really how to plug the person into society so that the person is not dependent on a disability support pension, so that the person is just not dependent on NDIS. Now, I'm not saying NDIS is no good. I'm saying NDIS is good, but really how to utilize that money to actually help to elevate, not even elevate, to help to improve the capacity of that person so that the person feels good about life and not just going out there for 1 hour, walking around in the shopping center and have Kentucky Fried Chicken and come home. Okay, now this is not a criticism. So really to be a useful, to be for him to feel that, look, life's great, I'm contributing, and this is what I want to do. A lot of ASD patients that I've come across, right, except sometimes the level 3, especially the high functioning one, the level 1 and 2, they do want to be somebody. They do want to do something. It's just that we don't know how to get them there. And I think the reason why we don't know how to get them there is because we just don't have enough concerted effort to get them there. And I'm so excited that Hillsong is doing this, and I hope that Hillsong will be the pioneer in this, and other colleges can start to do that. And yeah, so I'm just excited about the journey. So in a way, Justin has brought me onto a journey as well, something that I don't normally do. So it is. If I can use it this way, it is a test case. It's a pioneering case, and yeah, I really feeling very excited about this and looking forward to sort of doing my best to help to make this work. I think that's very important.